Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health. Cherish every movement. Many individuals, particularly as they age or remain seated for extended periods, have sensations of heaviness, swelling, tightness, or overall discomfort in their legs. It is simplistic to dismiss this as only a consequence of aging or inactivity. There are underlying factors at play. Understanding the circulation of blood in the legs reveals that these issues are not always permanent. By employing targeted, uncomplicated movements, you can enhance your circulation and alleviate unpleasant symptoms. This article outlines a pragmatic regimen consisting of 3 exercises, sometimes referred to as the 3-3-10 method. The concept is simple 3 distinct exercises executed in 3 positions, with each completed for 3 sets of 10 repetitions. I will elucidate the rationale for the routine's focus on leg circulation, the mechanics of the body's muscle pumps, the reasons circulation typically deteriorates with age and inactivity, and the proper execution of each exercise in a safe and effective manner. I will also address how to integrate the practice into your daily life methods for advancing its supplementary tactics that promote vein health and precautions to avoid any harm. The explanation aims to be impartial, lucid, and pragmatic, a non-pharmaceutical solution for a prevalent issue. The circulation of blood in and out of the legs. To comprehend the rationale behind the efficacy of these workouts, envision the circulation of blood in and out of your legs. The heart propels oxygenated blood through high-pressure arteries, such as the femoral artery in the thigh, and its smaller branches, including the popliteal and tibial arteries, which supply the lower leg and foot. Arterial pressure is sustained by the heart and supported by arterial elasticity, making the delivery of blood to the feet typically uncomplicated. Gravity and the heart's propulsion generally fulfill their functions effectively. Returning deoxygenated blood to the heart, however, presents a distinct challenge. After tissues utilize oxygen and nutrients, deoxygenated blood must ascend the leg against gravity. Veins facilitate this return journey. Nevertheless, they are lower-pressure conduits with thinner walls compared to arteries. By the time blood arrives in the veins of the feet, the heart's force has significantly diminished, rendering the veins unable to depend only on that pressure. The body employs a clever mechanical aid, the muscle pump. The function of the muscular pump. The muscular pump is precisely what it implies. Skeletal muscles, particularly in the calf region, encase deep veins. During activities such as walking, toe pointing, or pushing off, the contraction of these muscles compresses the veins and propels blood upward. Unidirectional bicuspid valves within the veins ensure that when the muscles relax, blood does not regress. The valves close promptly, allowing the vein segments to refill from below in preparation for the subsequent contraction. The calf muscles, namely the gastrocnemius and soleus, are crucial to this function, earning them the designation of the second heart. Additional minor pumps include the foot pump, which utilizes muscles beneath the sole to compress plantar veins, and the thigh pump, where the hamstrings and quadriceps compress adjacent veins during physical activity. The calf pump is the primary mechanism for facilitating the return of blood from the lower leg and ankle to the heart. When functioning optimally, venous pressure is maintained at a low level, fluid is retained within the veins, and tissues do not become edematous. When the pump malfunctions. When the muscular pump fails to function effectively, blood may accumulate in the lower extremities. Venous stasis elevates pressure within the veins. Venous hypertension compelling fluid to extravasate from the capillaries into adjacent tissues. The accumulation of fluid results in swelling, edema, heaviness, discomfort, tightness, and the fatigue that individuals often describe. Various causes can undermine or disrupt the pump system. Age with advancing age individuals frequently experience a decline in muscular mass and strength known as sarcopenia. Calf muscles atrophy or weaken, diminishing the mechanical compression on veins. Veins also experience a reduction in flexibility, and the unidirectional valves may deteriorate or become insufficient. Valve malfunction permits retrograde blood flow, exacerbating pooling and leading to disorders known as chronic venous insufficiency, CVI. Sedentary behavior. Prolonged sitting, whether at a desk during a trip or while watching television, results in the inactivity of leg muscles, which are unable to compress the veins. Assuming a seated position with bent knees and feet on the floor is particularly detrimental, as it contracts the calf muscles and promotes blood accumulation in the lower legs without muscular support. Prolonged standing is also suboptimal. It engages certain muscles for stability, but lacks the recurrent contraction-relaxation cycles necessary for efficient blood circulation, resulting in sluggish blood flow and an increased risk of pooling. Medical conditions, chronic venous insufficiency and varicose veins are direct venous disorders. Peripheral artery disease (PAD) impacts arteries and diminishes blood flow. Deep vein thrombosis. DVT is a thrombus in a deep vein that obstructs venous return and constitutes a medical emergency. Obesity elevates pressure on pelvic and leg veins. Diabetes may impair vascular integrity and nerve function. All these diseases alter baseline risk and may necessitate modifications to the use of activities. Pregnancy and hormonal fluctuations. Pregnancy elevates blood volume and intra-abdominal pressure, while hormonal changes tend to relax vascular walls, hence increasing the likelihood of leg edema and varicosities throughout pregnancy and the postpartum phase. Pharmacological agents and fluid equilibrium, specific medications, steroids, calcium channel blockers, certain anti-inflammatory drugs may induce fluid retention. Elevated salt intake and inadequate hydration impact plasma volume and interstitial fluid. Rationale for the efficacy of targeted exercises. Strengthening and routinely working the calf muscles, which serve as the primary pump for returning blood to the heart, enhances venous return. The 3-3-10 approach aims to reactivate the pumps in 3 distinct gravity settings, training the system to function in many typical daily scenarios, seated such as at a desk, supine with elevated legs resting or lying down and standing, walking or ascending stairs. The routine's length is a significant advantage since it requires only a few minutes to complete, facilitating multiple repetitions throughout the day, which is more beneficial for venous health than infrequent extended workouts. Brief, frequent activations assist in disrupting blood pooling and maintaining reduced venous pressure over time. Consider it analogous to consistently compressing a sponge. To avert excessive absorption, regular moderate compressions are more efficacious in averting overflow than a singular prolonged compression. Summary of the 3-3-10 methodology. The designation clearly indicates its structure. 3 distinct exercises executed in 3 body positions, with each exercise including 3 sets of 10 repetitions. The positions are selected for a specific purpose. Seated identifies periods when individuals are often inactive, such as working at a desk or traveling in a vehicle. It reinstates pump activity without weight-bearing, making it accessible for individuals with balance impairments or recent injuries. Supine legs elevated. Z position utilizes elevation to facilitate venous return by gravitational assistance, allowing for more efficient blood drainage while engaging the muscles. It is an effective choice for swift, temporary alleviation of heaviness and edema, particularly for individuals who must refrain from weight-bearing activities. Standing, engaging in functional weight-bearing activities that enhance calf muscular strength, hence improving pump pressure during routine motions such as ambulation and ascending stairs. The routine can be performed in a block format, completing all 3 sets of one exercise before progressing to the next, or as a circuit, executing 1 set of each exercise in succession, repeating the circuit 3 times. Both methodologies are efficacious. Select the one that aligns with your schedule and fosters consistency. The program often requires 3 to 5 minutes, facilitating its integration into regular life and enabling repetition several times. Comprehensive instructions and recommendations for each workout. Presented herein are sequential directions, prompts and safety precautions for each workout, along with frequent errors and beneficial modifications. Each exercise emphasizes full deliberate movements that highlight muscular contractions, which compress veins rather than rapid jerky moves. 1. Elevated ankle pumps in a seated position objective. Activate the ankle and lower leg pumps from a non-weight-bearing position while assisting the venous system through elevation. Required items: a sturdy chair, an additional chair or ottoman for leg support, and 1 or 2 cushions to ensure your calves rest comfortably while your heels remain suspended over the side. Placement and configuration. Maintain an upright posture with adequate lumbar support. Feet may be unshod or adorned with light socks. Footwear is not obligatory. Position yourself toward the anterior section of the chair, ensuring your hips and knees form approximately 90-degree angles. Position the ottoman or secondary chair before you and arrange cushions atop it for enhanced comfort. Elevate your legs such that your calves rest on the cushions while your heels extend beyond the edge. Ideally, your feet should be positioned at hip level or slightly elevated. The objective is to diminish the gravitational strain on the veins while preserving an active ankle joint. Single repetition of movement. Extend your toes downward as if engaging a gas pedal plantar flexion. The calf muscles should contract. Subsequently, retract your toes towards your shin dorsiflexion, so engaging the muscles located at the anterior aspect of your shin tibialis anterior. 1 complete point and pull constitutes 1 repeat. Maintain a fluid and deliberate motion. Repetitions pace and respiration. Perform 10 slow controlled repetitions every set, about 2 seconds for each phase, around 4 seconds for a complete repetition. Rest for 10 to 20 seconds between sets. Maintain normal breathing throughout. Execute 3 sets. If time is limited, perform a single set multiple times during the day instead of consolidating all sets into one session. Rationale: alternating contractions compress the veins within the calf and anterior lower leg, facilitating the upward movement of blood. Performing the activity from an elevated position diminishes the hydrostatic pressure that the muscles must overcome, so facilitating the process for individuals who have difficulty standing or are in the recovery phase from an injury. Frequent errors and their remedies. Avoid rapid and superficial movements. Strive for a complete range of motion and deliberate pace to ensure each contraction is significant. Allowing knees to droop or adopting a slouched position. Maintain an erect posture to prevent constricting veins at the knee. Engage the feet and ankles in several planes. Emphasize a precise plantar flexion dorsiflexion sequence while avoiding any twisting motions. Variations and advancements. Incorporate a resistance band around the forefoot for increased resistance. However, begin without resistance if experiencing edema or soreness. For restricted ankle mobility, perform smaller arcs and progressively enhance the range. To enhance circulation, momentarily halt at the apex of plantar flexion for 1 second before transitioning to dorsiflexion. Supine elevated ankle pumps, Z position. Objective: utilize elevation to facilitate venous return during pump activation. Effective for immediate transient alleviation of heaviness and edema. Required items: a level surface for reclining floor bed or couch, a pillow for head support, and a stack of cushions, or the back of a couch or seat to elevate your lower legs. An adjustable recliner or hospital bed is also effective. Placement and configuration. Assume a supine position. Advance until the posterior of your knees aligns approximately with your pelvis, ensuring your lower legs are parallel to the floor or slightly elevated, creating a little Z configuration with your body. Raise your ankles to a position distinctly above the level of your heart. Even a few inches can be very beneficial. If resting flat causes discomfort, placing a small pillow beneath the hips helps alleviate lower back tension. Ensure your lumbar region and cervical spine are well supported. Incorporate cushions as necessary. Single repetition of movement. From the elevated position, extend your toes out from your plantar flexion and subsequently retract them toward your shins, dorsiflexion. Execute 10 rhythmic repetitions every set, ensuring a relaxed neck and shoulders. Repetitions pace and respiration. Perform 10 slow repetitions. Pause for 10-20 seconds, and then continue for 2 additional sets. Strive for a consistent pace of around 2 seconds each movement while maintaining regular respiration. Refrain from performing the Valsalva technique by holding your breath throughout repetitions. Rationale: elevating the legs utilizes gravity to assist in the venous return of blood to the heart. The combination of elevation and muscle contractions facilitates the more efficient clearance of accumulated blood and fluid compared to elevation alone. Numerous individuals observe rapid alleviation of heaviness following a session. Frequent errors and their rectifications. Insufficient leg elevation. The legs should be positioned above heart level if it is comfortable and safe. Even slight elevation is beneficial. However, the greater the elevation of the legs in relation to the heart, the more gravity facilitates venous return. Arching the lower back. Provide support beneath the head or knees for comfort. Prevent tension on the lumbar spine. Avoid holding your breath or tensing your abdominal muscles. Instead, breathe steadily to prevent excessive intra-abdominal pressure. Variations and advancements. If complete elevation is bothersome, utilize a chair or adjustable bed at a moderate angle. For significantly swollen ankles, commence with limited ranges and brief sessions, progressively escalating as tolerated. Incorporate moderate ankle circles or toe spreads between sets to enhance joint mobility. 3 standing calf raises heel elevations objective: fortify the gastrocnemius and soleus muscles using body weight. Enhance muscular endurance for ambulation and daily tasks. Required items: a robust step, a low stair, a substantial hardcover book or an equivalent object for a heel drop, together with a wall or railing for support. Refrain from firmly grasping the railing or utilizing it for lifting. Minimal contact is okay for stability. Placement and configuration. Position yourself such that the balls of your feet rest on the edge of the step, allowing your heels to dangle freely. For a less intense variation, position yourself on level terrain with feet aligned at shoulder width. Grasp gently for equilibrium. Maintain an erect posture, chest, elevated shoulders at ease, core gently activated. Retain a small flexion in the knees if experiencing stiffness or soreness. Avoid hyperextension of the knees. Single repetition of movement. Gradually descend your heels until they extend slightly below the step, allowing for a stretch in the calves' eccentric phase. Apply pressure via the forefoot to elevate the heel's maximally concentric phase, contracting the calves at the apex. A complete lower and raise constitutes 1 repeat. Regulate the descent. The eccentric period is very beneficial for muscular fortification. Repetitions, pace, and respiration. 10 regulated repetitions per set. Approximately 2 seconds downward, a small break followed by 2 seconds upward. Allow a 20-30 second rest interval between sets. Execute 3 sets. Maintain a steady breath. Exhale during the ascent and inhale during the descent. This exercise promotes strength and endurance in the calf muscles through weight-bearing contractions. More robust and sustained contractions produce increased venous propulsion during ambulation, mitigating blood pooling in daily activities. Frequent errors and their rectifications. Employing momentum bouncing. Gradual, deliberate movement enhances strength and optimizes venous return. Utilizing a support to cheat the lift. Employ hands just for balance, not to aid the lift. Avoid locking or hyperextending the knees. Maintain a modest bend in the knees for comfort and safety as necessary. Advancements and setbacks. Simplify, perform double leg lifts on a level surface without elevation. Limit the range of motion and gradually expand it. Increase difficulty. Incorporate single leg lifts. Hold light weights, reduce speed more, or progressively augment repetitions, arc sets over weeks. Tempo variations. Slow eccentric movements 3 to 4 seconds downward and rapid concentric bursts can be alternated to enhance strength and power. How to incorporate the program into your daily schedule. Consistency is more significant than intensity for venous issues. The advantages of each session are somewhat transient. Therefore, engaging in frequent, moderate activity aids in preventing the persistent accumulation that results in edema and discomfort. Consider it analogous to routinely opening a valve to prevent a reservoir from overflowing. Minor frequent actions mitigate pressure. Consistent practice over days and weeks frequently results in less edema and reduced heaviness. Proposed timetables. Minimal. Perform the 3-3-10 program once in the morning and once in the evening. Daily practice. Perform the routine 3 times daily in the morning, at midday, and in the evening, particularly if you experience prolonged periods of sitting or standing. Regular micro breaks. When seated for extended periods, establish a timer for every 30-60 minutes to perform a brief session, 1 set of seated pumps or standing rises. Regular micro-activations are especially beneficial while travel or desk job. Circuit or module. Block method. Execute 3 sets of a single exercise prior to progressing to the next. This is effective and may be expedited. Circuit method. Perform 1 set of each exercise consecutively, then repeat the sequence 3 times. Circuits allocate exertion and can be more manageable in brief intervals, such as during work breaks. Assessing advancement and pragmatic expectations. Improvements may become evident within days, particularly with supine elevated pumps, yet significant enduring alterations in edema vein visibility or endurance generally require weeks of continuous application. Monitor advancement by integrating subjective and objective metrics. Subjective assessments. Daily symptom logs. Assess the heaviness, tightness, or pain in your legs using a straightforward 0-10 scale each morning and evening. Functional notes. Record the duration in minutes that you can stand or walk before to experiencing difficulty. Quantifiable metrics. Tape measure. Measure the circumference of the ankle and calf at the identical location daily, indicate with a small sticker, and at the same time to minimize variability. Photographs. Capture regular images of observable edema or varicose veins from consistent angles and lighting conditions. Additional beneficial metrics. Daily step count or walking duration to connect exercise with symptom variations. Document compliance with the regimen to validate cause and effect relationships as symptoms fluctuate. Supplementary strategies that promote venous health. The exercises constitute one component of a more comprehensive strategy. Integrating them with lifestyle modifications amplifies the advantages. Maintain overall activity. Consistent aerobic exercise such as walking, swimming, or cycling continuously activates the calf pump. Strive for around 30 minutes on most days, modified according to health condition. Periodic standing and walking intervals during extended periods of sitting are especially crucial. Maintain hydration. Dehydration elevates blood viscosity and may impair circulatory efficiency. Consistent hydration enhances circulation and overall cardiovascular health. A balanced diet that mitigates inflammation and maintains a healthy weight alleviates pressure on pelvic and leg veins. Restrict excessive sodium intake as it encourages fluid retention. Prioritize complete foods, veggies, lean proteins, and sources of healthy fats. Foods abundant in flavonoids. Fruits and vegetables rich in flavonoids, such as berries, citrus fruits, and leafy greens, provide modest advantages for vascular tone and contribute to a nutritious diet, but they do not substitute for medical intervention in venous disease. Compression therapy. Appropriately fitted, graduated compression stockings provide maximum pressure at the ankle, which progressively diminishes throughout the leg, facilitating venous compression and preventing blood pooling. They are especially beneficial if prolonged sitting or standing is required. A doctor or fitter can provide guidance on the appropriate compression level and fit. Prevent extended immobility. Intermittently disrupt lengthy durations of sitting or standing. For individuals engaged in desk work, establish reminders to stand walk or perform ankle pumps every 30 to 60 minutes. When standing for extended periods, frequently shift your weight and perform little pumps or heel rises. Sleep and repose. Elevate the legs during rest when possible, even short durations of elevation. 15-20 minutes diminish venous pressure and can be rejuvenating. Safety contraindications and circumstances to avoid certain workouts. This material does not replace medical advice. Individuals with specific medical issues may find these activities hazardous or requiring modifications. Consult your physician prior to commencement, particularly if you possess any of the following conditions. Deep vein thrombosis (DVT). If a blood clot in a deep vein is known or suspected, refrain from engaging in muscle contraction exercises. They could displace a thrombus and induce a pulmonary embolism, which is potentially fatal. Seek emergency medical assistance if you observe sudden, unexplained swelling pain, redness, or warmth in one leg. Congestive heart failure (CHF). If your heart is already compromised in its pumping ability, the swift return of a substantial volume of fluid from the extremities to the central circulation may overwhelm the heart. A physician must approve any exercise regimen designed to alleviate leg edema. Severe peripheral artery disease. PAD individuals with PAD may experience pain during physical activity claudication and may require a supervised, customized regimen from a healthcare professional. Open wounds, ulcers, or infections on the legs or feet require medical evaluation prior to initiating workouts that enhance circulation or exert mechanical pressure. Compromised or delicate skin requires expert attention. Recent injury or major surgery. If you have a recent fracture sprain or are in the immediate post-operative phase, adhere to medical advice and allow the injury to heal before commencing workouts that exert stress on the affected area. Exercise-related warning signs: cease activity and seek medical attention if you encounter abrupt, unexplained edema of a single limb, intense acute pain in the calf or groin, unilateral leg erythema or increased temperature, acute chest discomfort, abrupt dyspnea, vertigo, or syncope. Particular demographics and unique considerations. Seniors initiate with caution. Prioritize seated and supine activities if balance is a concern. Utilize a solid chair and ensure support for equilibrium during standing lifts. Incrementally elevate intensity as tolerable. Pregnancy edema in the lower extremities is prevalent. Seated and supine workouts may be beneficial. However, resting flat on the back during late pregnancy might be difficult or contraindicated for certain individuals due to vena cava compression. It is advisable to alter elevation by lying on the left side with legs elevated or adopting a semi-reclined position. Consult your obstetric physician regarding safe positions and the use of compression stockings. Diabetes. Individuals with peripheral neuropathy or foot ulcers must exercise caution. Safeguard the feet, mitigate pressure points, do daily inspections, and consult a professional podiatrist or diabetes nurse for advice. Post-surgical patients. Following operations, particularly orthopedic, vascular, or abdominal procedures, adhere to the surgeon's or therapist's directives for the initiation and execution of leg pumping exercises. Early mobilization is frequently advocated, although customized according to the procedure. Pragmatic advice for everyday life and particular circumstances. Journey. During flights or extended drives, perform ankle pumps and standing calf lifts anytime it is safe to stand, such as during layovers or rest breaks. Periodically traverse the aisle and refrain from extended periods of immobility. Opt for aisle seats to facilitate moving. Consider utilizing compression stockings during long-haul travel, particularly if you possess additional risk factors such as a history of DVT, obesity, or pregnancy. Employment. Maintain a compact footrest or cushion beneath your desk to facilitate seated elevated pumps during work. Utilize a sit-stand desk when feasible and incorporate brief breaks to stand and stroll. Establish reminders on your mobile device computer or smartwatch to engage in movement every 30 to 60 minutes. Residents employ the supine Z position while engaging in television viewing or reading. Position a step near frequently utilized locations, kitchen sink corridor, to facilitate standing raises while awaiting the kettle or brushing teeth. Integrate the routine with everyday habits post-coffee pre-sleep to facilitate automaticity. Shoes. Refrain from wearing shoes that impede foot circulation or limit ankle mobility for extended durations. Optimal everyday calf pump performance is achieved with supportive, flexible footwear that facilitates natural ankle movement. Compression stockings, practical considerations, types over the counter. OTC compression socks provide mild compression, typically ranging from 8 to 15 mm or 15-20 mm. Medical-grade stockings are available in higher compression levels, 20, 30, 40 mm, and are typically tailored by a professional for particular medical concerns. Fit and appropriate fit is crucial. Excessive tightness at the calf may induce a tourniquet effect, whereas excessive looseness renders it ineffectual. A fitter recommends accurate measurement of ankle calf and occasionally thigh circumference. Application. Don them in the morning while edema is minimal and remove for bathing, and during the night unless otherwise instructed. Utilize donning aids if you experience challenges in putting them on. Contraindications. Severe peripheral artery disease. PAD is a relative contraindication. Consult with a clinician. Troubleshooting and frequently asked questions. Q. When can I expect to observe results? You might experience temporary alleviation from elevation and pumping between minutes to hours. Enduring alleviation of chronic edema or heaviness typically necessitates sustained practice over a period of weeks to months. Enhancements in strength and endurance of the calf muscles occur over a comparable time frame. Anticipate incremental progress over 6 to 12 weeks with consistent effort. Q. Can these workouts remedy varicose veins? A. They will not rectify pre-existing structural damage to veins or valves. Nonetheless, they can alleviate symptoms, decelerate progression, and enhance quality of life. A vascular specialist might recommend further treatments for structural vein issues such as sclerotherapy, endovenous ablation, or surgical intervention. Q. What should I do if my legs experience increased discomfort following exercise? AA. Slight increase in feeling or muscular pain may arise during the initial sessions, particularly if the muscles are deconditioned. If pain significantly escalates, or if there is redness, warmth, or unilateral swelling, discontinue and seek medical assessment. Modify the intensity and positioning if exercises induce discomfort. Q. What is the daily frequency? A. Engaging in the program. 2 to 3 times daily is a pragmatic initial approach. Incorporate brief micro-sessions every 30 to 60 minutes if you remain seated for extended durations. Frequent intervals and regular breaks are more significant than a single extended session each day. Q. Is it possible to integrate this with a workout regimen? Affirmative. Integrate the 3 to 3-10 approach with aerobic and resistance exercise for holistic cardiovascular and lower limb health. Continuously assess general weariness and recuperation and advance gradually to prevent overexertion. Q. Is there empirical evidence endorsing these exercises? The physiological justification is robust and corroborated by research, indicating that calf muscle activity enhances venous return and that the combination of compression and exercise alleviates symptoms. Numerous clinical trials concentrate on integrated approaches, exercise, compression, weight control for chronic venous insufficiency. The activities are frequently advised in professional guidelines as conservative strategies to alleviate symptoms and enhance mobility. When to consult a clinician? Consult a healthcare practitioner if you experience abrupt, unexplained edema in a single limb, pronounced pain, erythema, hyperthermia, or sensitivity in a lower limb. Symptoms of pulmonary embolism include sudden shortness of breath, chest discomfort, and lightheadedness. Chronic persistent edema that fails to respond to home interventions, dermatological alterations, hyperpigmentation, chronic erythema ulcers, or exudation in the vicinity of the ankles or lower extremities. Diagnosed with vascular disease and seeking a customized workout and compression regimen, sample 4-week introductory plan. Week 1. Morning and evening 3 to 3:10 once per session, totaling 6 sessions per day if desired. Concentrate on structure. Micro breaks. Perform 1 set of seated pumps every 60 minutes while seated at a desk. Week 2. Augment to 3 daily sessions morning, midday, evening, of full 3-3-10. Incorporate 10-15 minutes of moderate walking each day. Week 3. For progress in standing calf lifts, increase the repetitions by 1 per set or attempt single leg raises for 2 to 3 repetitions. Maintain consistency in seated and supine activities. Week 4. Reevaluate symptoms. Elevate standing difficulty weights or pace just if at ease. Conduct 3 daily sessions and engage in 20-30 minutes of walking each day. Strategies for adherence and motivation. Integrate the practice with established routines post-shower during commercial intervals prior to sleep. Maintain equipment small step cushion in conspicuous locations. Utilize reminders on your mobile device or calendar. Document minor achievements, record improved sleep, reduced evening edema, or extended periods of comfortable standing. Conclusion. Compromised leg circulation characterized by edema discomfort and a sensation of weight is prevalent yet frequently controllable. The fundamental issue is typically inadequate venous return, with the calf muscles being instrumental in reinstating that function. The 3-3-10 method is an effective practice that focuses on exercises from 3 positions seated supine with legs elevated and standing. Executed daily and integrated with prudent lifestyle modifications, exercise, hydration, optimal weight, and when suitable compression, it aids in reactivating circulation, diminishing venous stasis, and fortifying the muscles responsible for pumping. This workout regimen constitutes merely one component of a comprehensive strategy for vascular health. This does not substitute for medical diagnosis or treatment. If symptoms are chronic, severe, or suddenly exacerbate, visit a healthcare expert to exclude serious diseases and obtain a tailored plan. Through regular practice, prudent lifestyle adjustments, and appropriate medical supervision when necessary, specific targeted exercises can significantly enhance the comfort and functionality of your lower extremities. Every day, you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together, we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement.